Oh, I'm the mother.
Yeah. Hi, my name's Lexi. I am the Psych NP, and I'm here today to meet you and your daughter. I know that this is your initial visit, both of you, and you had some concerns about your daughter, and she was just discharged from the hospital. I just saw her paperwork. So, yeah, do you want to just tell me her full name just to confirm, and we'll go from there?
Her name is Ginger Roberts.
Wait, that's a mom's name? Wait, Ginger Roberts?
Okay, yeah.
Okay. But
That's a mother's name. Sorry. Her name is
what's the daughter's name?
Bella.
Okay. So Bella. And what are her preferred pronouns?
I believe it's she, her.
Okay. And her date of birth?
Her date of birth is August 23rd. That year she was born.
Got it. And alrighty. And okay, so I'm gonna talk to you first, and then I'm gonna talk to Bella privately if that's okay.
2008.
2008, thank you.
Mm-hmm.
And I know you have a couple other kids, so it can be a little hard to remember all their birthdays.
Stepchildren, yeah.
Yeah.
I have one daughter.
You have, okay, so Bella has a
sister, Gabby.
stepsister.
No, biological sister, Gabby.
Mm-hmm.
Yeah, but you said, I had more children. I was, you know, living in a neighborhood, you have, they call you
everyone's
mom.
your kid. Yeah, for sure.
Mm-hmm.
Well, yeah, so I saw Bella was discharged from Bellevue Hospital recently within the last couple of days, and she was admitted for a suicide attempt. She has a history of depression.
Yeah.
When that started, her depression.
So it started like about 6 months now.
Okay. Has it gotten it sounds like it's gotten a little worse over that time.
Yeah, so Bella hasn't been herself. Bella used to love playing tennis, hanging out with her friends, and she had a boyfriend. And I think this all started when her boyfriend broke up. Yeah, and then she had some incident with her friends, and they stopped talking with her.
Oh no.
And it so happened it was around the same time that her boyfriend had broke up with her.
Everything at once.
Yeah.
Yeah.
And she just started to isolate herself, not go outside, just be in her room. The room was dark, not talking to anyone, just wasn't herself. And she loved playing tennis. She didn't even want to play tennis.
She just wanted to stay in her room. And and before that, I mean, it sounds like, based on what I've read so far, she hasn't had really any symptoms of depression beyond the last 6 months, it seems like.
No.
Or the last year, I should say, because I know she was diagnosed about 6 months ago, but nothing from like her childhood or
no, well, in her childhood, like medically, she was riding her bike, and she wasn't wearing a helmet, and a car ended up hitting her, so she had a concussion and a left radial fracture.
Okay.
That's the only thing that really happened in her childhood.
Yeah, and I know that I think I saw that she was, I can't remember how old she was, but I think I have the record. And any besides that, that's definitely important for us to know, especially with head injuries. Do you know of any like infections in her childhood, like that, any diseases, any infections, or any medical hospitalizations, not including like the inpatient psych Bellevue she just was discharged from?
No, the only thing she did have was like teeth surgery, like mouth wisdom tooth, yeah.
Okay.
But no, my history, I had suffered with major depression.
Okay.
Yeah, I don't know if that's important.
Yeah, actually it is. We can skip a little bit forward to the family history, and that's fine with me if we want to touch on that. So you have a history of depression.
Yeah.
Any postpartum depression?
No,
Okay.
I was going through a lot, and they had put me on Lexapro and
Mm.
Prozac.
Okay.
Yeah. That was in the past.
Are you on medication currently?
No.
No. Okay. Do you have a therapist?
Yes, I do
Okay.
see a therapist.
Okay. So it's treated with therapy.
Yes.
Any other family history of any psych condition, diagnoses?
Actually, my mom
Mm-hmm.
as well. She also suffered from depression as well.
Okay.
Yeah.
And I think I might have seen in some of the paperwork her sister also has depression. Gabby, is it?
Yes. Oh, yes.
Uh-huh.
Yeah, Gabby. Nothing medically, but
Mhm.
Gabby was showing signs of depression as well. Yes.
Okay. Is she in therapy?
Yes, she's receiving therapy.
Okay. Anything on dad's side?
Dad is fine.
Okay.
No, he doesn't have any psychiatric history. Yeah.
Okay.
No, in his family. Yeah.
And alrighty. And how would you say? I know this is kind of a weird question to ask, but just to get a sense of kind of like the family dynamics of home. At home, do Gabby or do Bella and her sister Gabby get along?
Not really. You know, since Bella became a teenager, you know, things started to change.
Yeah.
And their relationship just changed. And you know, Bella just wants to be by herself, and you know, I think she feels like a sister annoys her, so they don't really have a good relationship.
I'm sorry to hear that. When they were younger, were they closer? And
yeah, they would
teenage
play
years,
together.
now they're kind of going through stuff. Yeah, that can be hard. I know that to be the case for a lot of families, and usually, it's sort of like temporary, and then once they get past those teenage years, usually they get closer. But I know it's really frustrating, and as a mom, you just want them to be close, and so yeah, I hear you. And how about like any family? I know they kind of argue here and there, but any like major family conflicts or issues that you know of?
My husband and my marriage is pretty much okay. My husband didn't lose his job, and he just got a new job. So I don't know if Bella may have also take that in, because he was
picked up on it.
Yeah. She probably saw me really frustrated because I had to like do a lot. Yeah. So I don't know if that probably contributed to it, but that's the only major thing that happened in our household. Otherwise, our household is pretty much a loving, supportive.
Good. I'm happy to hear that. Okay. Any family, any members? I know this is a very like blunt question, but just that we have to have this information. Any family members with any suicide attempts or completions in the family?
My brother, he attempted suicide. Yeah, that's.
I'm sorry to hear that. And he's still alive?
No, he succeeded.
Okay.
Sorry. Why did I put that in? I'm so sorry, guys.
Okay.
I'm giving you more work. I apologize.
I'm
I'm sorry. I'm going off
sorry
the
to hear
script.
that about Bella's uncle. When did that happen?
5 years ago.
Okay. And I guess Bella and her daughter or her sister were quite young then, so maybe they didn't really like remember it too much. Okay, yeah, that must have been really hard on you and the rest of your
That's
family.
what led to my depression.
Oh, okay. I understand now. Okay. And just gonna circle back a little bit. I just had a couple more questions. I don't think there were any other inpatient hospitalizations. That was the first time for Bella a couple weeks ago.
Yeah.
And how many days was it?
14 days.
Okay. And she was diagnosed with depression?
Yeah, major depression.
Any violence history, like violence towards others or anything like that?
No, like I said, no
Mm.
violence towards others. She was just isolating herself, very irritable, but just
Okay.
isolating herself, not, doesn't want to speak to anyone. So I'm not sure if it's her being a teenager or, it's just really hard,
Okay, and I know I just said she was diagnosed with depression in the hospital, but now I'm remembering, actually it was, I think 6 months ago. Do you know, so that was her diagnosis from 6 months ago. Could you just tell me the name of the person who diagnosed her? Was it a primary care provider or a psychiatrist, or I know that she was started on some medication, but just so I can get those records.
It was a psychiatric provider.
Okay.
Yeah. Who started her on Suturing 50. When she
Okay.
discharged from the hospital with Suturing 50.
Okay. And any other previous psych diagnoses? Looks like, just from what I have, it's just depression. Not just depression, but no other diagnoses like ADHD as far as you know.
No. She had my pregnancy with her. She was born full term.
Oh, good.
No complications. It was a non-complicated pregnancy.
She met all her milestones on time.
Yes. She met all milestones.
And she's the youngest. And met milestones on time. So no environmental issues. Like, I know that they checked for lead at the pediatrician. No like history of lead or anything, or issues with that. Okay. Alrighty. And let's just see here. Has she had any surgeries? I guess
Just
she had
the
the wisdom. Yeah.
Oh, and from the left calf
Fracture. That's right. Nothing else though. Okay. And then, so just as far as medication, you said sertraline 50 daily.
Multivitamins.
Okay, multivitamin. Good.
Vitamin D.
And vitamin D.
Yeah.
Right. I saw that. I think it was 1,000 IU. Okay. And she hasn't been on any psych meds previously.
No.
Alrighty. And then I'm about to bring her in a moment if that's okay with you, and then I'll speak with you one more time after, and we'll just discuss everything and come up with like the treatment plan and go from there, okay? So as far as yeah, I think actually that might be everything that I need from you, Mom. So
You can always ask me again.
Yeah, thank you. I think that's basically it. So I'm gonna call Bella into the room, and it was really nice meeting you,
Nice meeting you too.
Miss Ginger Roberts.
Thank you. Okay.
Hi Bella, my name's Lexi. I'm a psychiatric nurse practitioner, and thank you for coming in today. I know you've had a really tough couple of months, and especially the last few weeks, and I'm really sorry to hear you've been going through, and I really want to help you, and kind of hear how you've been doing. So can you tell me how you're feeling today?
I'm feeling okay, much better than how I was feeling 2 weeks ago.
Okay, good. I know that you were, I'm just going to grab your paperwork over here just to go over a few things. I know that you stayed about 2 weeks at the medical center, and you were started on some medication. Are you having any side effects from that medication? As far as you know, nothing feels different just yet. I think it's a little too early to tell. I know they probably told you in the hospital, but it can take 4 to 6 weeks, sometimes even a little bit longer to start to feel that. But yeah, are you I'm just, checking in, and I want to kind of make sure that we can be honest together, and so I'm going to ask you very blunt questions, okay? And I have to ask you these at every visit, so I know it's annoying or it might be a little repetitive, but I have to ask you every time if you're having any suicidal thoughts or thoughts of self-harm currently. I know that you denied that earlier today when you were seeing the nurse for intake? No? Okay. Or thoughts of harming others? Okay. Any hallucinations or weird visual disturbances or anything like that? No? Okay. How's your appetite been? Mom said, that you were not really hungry before hospital and you didn't want to eat and you were kind of sleeping all the time. Is that kind of same still or?
No, I'm trying.
Yeah.
I'm trying.
It's hard. I hear you. So not really any of an appetite. And how you been sleeping a lot, Bella?
Yeah, I stay home. Just lay down most of the time.
Okay.
I'm just like, I kind of just haven't been myself yet. It's been hard, so I've just been inside, just been inside.
Yeah, I want to ask you more about that because I know that you had some stuff going on with friends and a boyfriend, but I just want to go over kind of some body symptoms first, if that's okay with you. And I know that you are taking vitamin D as well, but any like fever, chills, body aches, fatigue? No.
Fatigue.
Okay. And
I just feel tired, but that's about it.
Any like runny nose, sore throat, ear pain,
No.
congestion, eye pain, weird discharge coming from the eye, nothing like that. Okay. Any heart palpitations or chest pain?
No.
Okay. Any difficulty breathing or shortness of breath?
No.
Any problems pooping or peeing or feeling like bloated or gassy?
No.
Or diarrhea? Okay. And I think you might be. I think your period was about a month ago. Are your periods? It looks like your periods are usually normal.
Yeah.
Okay. Any issues with your periods, like really crampy or heavy? No.
No.
Okay. Any muscle aches or pains?
My period
Oh, sure.
is kind of heavy.
It's a little heavy. Okay. How many days does it usually last?
6 days.
Okay. When you say heavy, how many do you use tampons or pads?
Use pads.
Use pads. So how many pads are you going through a day?
I think about 4.
Okay. Yeah, that's kind of a lot. And I can see here that you're actually I don't have the first age of your period.
19? When I was 9.
Oh, okay, that's quite young.
But it just started to get heavy recently.
Oh, okay. Okay. Thanks for letting me know. Any skin rashes or any problems? What about any?
Just little acne here and there. But
Okay. Are you you use like a special soap at home or cream?
Yeah.
Okay.
Over the, I get it in the pharmacy to
Got
just
it.
wash my face.
Okay. Yeah, your skin looks good, but I know at this age it can be really frustrating to kind of treat that stuff. Okay. Any hormonal issues as far as you know? Have you ever been issues with your blood in the past? No history of anemia as far as you know?
Not that I know of.
Okay. And any problems? I know that you had a pretty bad accident when you were 8. You had a concussion and a radial fracture, and you didn't have a helmet on. Have you had any problems like any blurry vision or headaches or maybe any like balance problems or dizziness or nausea? No? Okay, none of that. Alrighty. Thank you for answering all those. I know that's a lot. Well, I won't be asking those at every visit, just, we have to get all the stuff in the beginning, so I do appreciate it. Okay, so, I know you mentioned that your periods are kind of heavy. Have you seen your primary care provider recently?
Mm-hmm.
No, it's been like over a year, you think?
Yeah.
because something that we might want to check for, you know, especially with really heavy periods, it can contribute to that fatigue, because when we lose a lot of blood through our periods, it can cause anemia. And if we're not getting enough iron in our diet and replenishing, sometimes that can contribute to some of the symptoms you're having. So we might want to, you know, get some blood work, and you don't have to worry about remembering that, but that's just, you know, I'm just letting you know we might want to do some blood work. And also to check your vitamin D, because I know you take it. We want to make sure that it's enough and that it's helping, because in this part of the country, in the Northeast, I mean, everybody has low vitamin D, which can also actually impact your mood too. So, and you know, I'm going to talk to your mom about this, but we might want to do some blood work just to make sure we don't have any contributing things with your mood, okay? So, yeah, so I kind of wanted to know, you know, your mom told me a little bit about things, but this is, you know, confidential what we talk about. And I know that you were feeling kind of, you know, depressed, starting to feel depressed about 6 months ago when you had that falling out with your friends. Can you tell me a little bit, like, what happened?
You know, I broke up with my boyfriend, and you know, my friends and I, we were just hanging out, and you know, I told them a lot of personal things, and they saw my boyfriend, my ex-boyfriend, passing with another girl, and then they're like, oh, that's the reason why he didn't want to be with you. You know, you are this particular way, you're annoying, and you know, we can't.
Oh, I'm so sorry, Bella. I'll get you a tissue. I know, it's tough. You know, people can be quite mean in high school.
But I think they knew, because it was around the day he broke up with me. And the anniversary when he broke up with me, you know, they pretend like they were taking me out, and that was the same time that he was passing with a girl, and then they all came up at me and started to say these nasty things. So
that sounds so hurtful. I'm so sorry.
I thought they were my friends, but
I'm sorry that you had to go through
so
that.
that's what happened. Yeah, that's what happened.
You're really crying. I can't believe you're really crying like that. I'm so sorry though. You know that you don't deserve that. Like that's not fair. They were your friends.
Right, I hope this is recorded.
Have you had any? Do you have any other friends that you've been hanging out with, or was that like your group that?
I have one best friend. But she moved, so
where did she move?
She moved to Alabama.
Okay.
And because she's settling, we don't really talk that much.
Okay.
But she's my really good friend. She's been like, you know, you can call me, you can talk to me about anything.
But she's a little far. You don't really have anybody at high school. What about your sister Gabby?
I don't know, like, I feel like she's just nosy.
Yeah,
just
sisters
trying.
can be like that.
Always want to know, like, you know, what's going on, and like, I just feel like I can't breathe and can't be myself, and I just like, and then I think my parents probably like her more, you know, because she's so intelligent and doing well, and you know, I don't know, I just hasn't, just our relationship just changed, like I haven't been, you know, she was really cool, but
you guys used to get along more.
You know, we used to go to the movies together and go shopping together, but I don't know, she's just like, I don't know, she's just a little annoying, and I just feel like
hard to get some space in the long time. Okay. Yeah, I understand that. Do you guys in your family, do you practice a religion, or were you no? Okay. And what's your background?
I'm Caucasian.
Okay, so you're Irish and Italian. Gotcha. Any Mom said you played tennis. That was something you were interested in, and
Yes.
you were really into for a while, but not recently.
Yeah. I don't know. I just haven't been just feeling tired, and I just feel like, you know, I maybe let's see how the medication works, but you know, I am getting therapy now.
Good. Is that helping or?
Yeah, they made me write a journal and you know to express myself. So it's been helping. You know, the therapist is very supportive.
Good.
Yeah.
What's your therapist's name?
Cassandra.
Okay. Alrighty, great. And you started that after you were discharged from the hospital?
Yeah.
Okay.
It started in the hospital, then it continued.
Okay, good. And I wanted to know a little bit more, like how are you doing in school right now? I know that you're
prior to me going to the to being hospitalized or after I came?
I guess before.
So yeah, my grades had dropped, you know, and I didn't feel like going to school, you know, cause the girls were there, and I just didn't feel comfortable in class.
Yeah.
And so I just haven't really been able to focus on my studies.
That makes sense. So I know that you're 15.
14.
Oh, sorry, 14. That's right. I can't do math. Thank you. Thanks, Bella.
Oh yeah, it was. I said 2008, right? 2007.
You were born, so March. You're 15 now. Yeah. Okay. So I know that you're starting to think about maybe your future a little bit in college. I know that you've been feeling a little down, but did you have any idea in the past of what you might want to go into, or?
Well, I wanted to be a tennis player.
Wow.
Professional tennis
Yeah,
player.
Mom said you were really good.
Yeah.
Oh my, that's awesome.
Yeah, I won a lot of
tournaments?
Yeah.
Wow. Would you go to college and do that first, or do you want to just go straight to pro?
Well, I was getting a scholarship. You know, if I continue with the high school that I attended, I'll get a scholarship to go to college.
Wow.
And while I guess studying in college, I wanted to computer science.
Good.
Yeah.
Okay, great, Bella. So, and I know that, you know, I just want to let you know that everything we talk about here is confidential, and the only things that I would need to tell Mom are things that would impact your safety, okay? So, I do need to ask you about some personal stuff, like alcohol and some drug use.
You're not gonna tell them.
I'm not gonna tell your mom unless it's a risk, okay? So everything here is confidential, but it you know, I want to be able to help you, right? So I do need to ask some of these questions. Do you use any alcohol, or have you ever drank alcohol?
Well, with my friends, I drank alcohol.
Okay. How often were you drinking with those friends?
Like once a month.
Once a month, okay. Like at parties or like a sleepover?
At a sleepover.
Okay.
Yeah.
How much were you drinking in those instances?
Just like a sip or something.
Just
like we got
sip.
one beer and we were just like
sharing it.
Yeah.
Okay, amongst like 4 or 5 of you.
Yeah.
Okay. Any illegal drug use or tobacco use, marijuana or cigarettes or any pills?
I did try to smoke weed.
How many times was that?
Once.
Okay.
We did have like edibles.
When was that?
Oh, about a year ago or 6 months ago.
Okay. With friends, you tried edibles.
Yeah.
Oh, okay. And how did that make you feel?
Weird.
Yeah.
It felt weird.
Not in a good way.
Yeah, not in a good way.
Okay. And Bella, I know that you recently, had that breakup with your boyfriend who you were with for 8 months. Were you sexually active with him?
Yes.
Okay. Did you have vaginal penetrative sex with this person? Okay. And did you use condoms?
Yes.
Okay. So, okay. Have you ever had any STD testing, like with a gynecologist or that local clinic nearby that's free? No? Okay. So that's something we can do as well, or I can refer you somewhere that does it for free that won't go through insurance, so that way mom doesn't need to know. It's good to get that done every year if you are sexually active, okay? And it's good that you are using condoms. But we do just want to make sure that you're clear of like any STI infections, right? I know you learned about that in health class. Alright, so I am just looking over everything we just talked about, and I kind of wanted to hear, a little bit about like what happened, with your boyfriend, and I know you took a lot of pills all at the same time. I believe some Advil and vitamins and the vodka that was in your dad's liquor cabinet, and that was like a day after you guys broke up. So
He told me that he loved me, and he really cared about me, and that's why I, had sex with him. And then he just said one day that he didn't want to be with me anymore, and that I was annoying, and he just can't be around me, and that really broke my heart because I believe him, and I slept with him.
Absolutely. It's a very personal thing to do, and that's a very important part of your life, and you were with him for a while too. You had a lot of memories, so I can understand where you're coming from.
So I just couldn't take it. I didn't want to look at myself in the mirror. I'm like, if he doesn't want me, nobody else will want me.
Alicia, I'm sorry you feel that way, and
Bella.
Oh. Bella, I'm sorry you feel that way, and I want to tell you that's not true, because I know it's not true, but I need you to believe that I want you to believe that for yourself, and maybe over the course of us working together and you seeing Cassandra, your therapist, we can help improve that. Okay. Now, do you have any questions for me? No. Okay. I think that's basically everything. I'm gonna call mom back in and just chat with her, and I'll have you in the room as well, okay? And we're gonna just kind of go over next steps with everything all together. And like I said, the stuff we talked about is confidential, okay? All right. All right. Hi, Miss Ginger Roberts.
So tell me how you
Yes. So Bella's just so lovely and sweet, and I know she's been through a lot, and you do have a bit of a family history of depression, and that might factor in. And you said you had it. I don't know if you maybe have made this connection in the past, but your brother committed suicide, and with your history of depression, which is treated, and her sister and grandmother, there might be some genetic component, and that doesn't mean it's anybody's fault. But in combination with things that can happen in life, like breakups and issues with friends and trauma and things like that, it can kind of have this synergistic effect. So I think I want to tackle this, and really help treat Bella from like different all different perspectives, right? So
Okay.
I do want to keep her on the medication, and it may or may not be a long-term thing. Usually at this age, we do want them to be on it for at least a year. The research does show that being on it long-term is most helpful.
Okay.
It doesn't mean that she won't ever be able to get off of it, but it's not, as you know, because you've been on SSRIs in the past, you don't really want to just kind of jump off of it once you start to feel better, right? At least 6 to 9 months. So with Bella, she's on the, now let me double check because I keep, she's on the sertraline, the 50 that she was started inpatient, and that was
6 days ago she was discharged.
okay.
Yeah.
Yeah, 6 days ago. So we do want to keep her on that for a bit and try that for about 4 to 6 weeks. Sometimes
Okay.
it can even take up to 8 weeks.
Okay.
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 We're gonna have you guys come back like every 3 to 4 weeks though,
Okay.
and just check in.
Okay.
But we're gonna keep her on that for now, and you know that's something that we can always increase in 25 milligram increments in the future. So if we're finding that it's not helping as much, we can increase to 75. You know, it's it can be a little hard to predict like what dose somebody will need, right? Like it doesn't have anything to do with BMI. It doesn't have it's everybody's biology and chemistry is different. So we'll keep her on the 50, increase it to 75, and I want you guys to keep doing the vitamin D.
And that's when you do the that's why you had to do the questionnaire with her.
The PHQ-9, yeah. I'm sorry, that's right. We haven't even gone over that. So I know that I'm just Bella, we were
and then she mentioned that you asked her some questions and you said you were gonna be asking her to just see if she was improving.
Yeah, so it looks like, she said she doesn't have any thoughts of suicide or self-harm, which is definitely an improvement. She's not feeling angry. Her anxiety is about a 4 out of 10, and her depression is about a 7 out of 10. So, based on those and the PHQ-9 and the GAD-7, it seems like, anxiety and depression often do go hand in hand. And, I think we can reduce the anxiety as, if once we start to tackle that sadness and depression.
Okay.
So we'll, continue with that. I also wanted to get some blood work, if that's okay with you, or we can have her primary do some blood work, because I know it's been a little, I think it's been a year or longer since she had her physical.
Yeah.
And not that we normally do like regular blood work at that age if they're young and healthy, but she has pretty heavy periods, right, Bella? And we were talking about this in the room, sometimes that can contribute to anemia, so I think I want to just check her for anemia, check and make sure the vitamin D is good. I also want to check her thyroid. I know that you didn't mention on the intake form any family history of any like thyroid issues, but sometimes that can contribute to mood as well.
Okay.
So we'll do that, and then or we'll have the primary do that, and then I also wanted to know, I know she's getting sort of like supportive therapy with, or talk therapy with Cassandra.
Yeah.
Now, there's a lot of research that shows that in addition to the SSRI, combining that with something called CBT, cognitive behavioral therapy, can be really, really helpful for treating depression, especially if it's more moderate to severe, in addition to having any suicidal thoughts. That's been shown to help in combination. So I don't know if that's something that you're open to and she can continue seeing Cassandra, or if that's something that Cassandra is certified in, because I could get a release of information so Cassandra and I can talk and figure that out. But I really would love if you guys consider that, because I would love for Bella to start doing that. I think it would be really helpful. It's basically, Bella, what it does is with the CBT, you change your thoughts and your behavior. So it kind of tackles it from 2 different ways, right? So you're challenging some of those negative thoughts and you're changing some of those behaviors. I know right now it's really hard to do that, but hopefully with the medication and with the therapy, as we progress, that gets a little bit easier, and then it becomes more second nature, and your mood starts to improve. And then the other thing,
I think that's I think it's a good one.
Yeah. And then the other thing is, I was thinking, I don't know if Bella has a guidance counselor or somebody at school that you guys talk to about maybe some of the. It sounds like there might have been a bit of bullying with some of the friends that happened. You know, less of a falling out, maybe some bullying going on. You know, so that might be something to consider. Is you know, kind of getting a sense of what the school might offer for support, and you know, making sure that Bella feels safe and comfortable and not, you know, a victim of anybody or anything. And you know, high school is really tough. It really is, and people can be really mean, but you know, there are lots of good, you know, adolescents and kids out there like you that, you know, want to like have good friendships and be nice to others. And not everybody's a bully, but it can be really challenging. So I think that getting guidance, counseling involved would be helpful as well, just so that they're aware of things.
Thank you.
You know, I'm happy to give the school a call. Maybe we can set up a meeting together and we can talk about that later. Just to talk to the counseling center. But yeah, I just wanted to check in, Ginger, and see if you had any questions. I know your husband couldn't be here today, but I don't know if you had any questions as well. But I'm happy to answer anything. And
well, I know I have your business card, so I can always call you if I have any questions. You said that in 3 weeks we'll have a
I think 3 weeks might be good because that'll be about 4 weeks from when she was discharged, Bella, you were discharged. And I just want to do like a 1 month follow-up check-in.
Okay.
Especially because that's, you know, you've been on that medication for that point, and sometimes, you know, things start to change and get better. We also want to check for side effects, and you know, we'll reconnect with the guidance counseling stuff too. Okay?
Sounds wonderful.
Awesome.
Thank you so much, Bella.
Yes, thank you. It was nice meeting you both, and I look forward to working with you. Okay.
Thank you.
Take care.